Welcome to Homegirl Knows Best. This show is about the people, the stories, and all the messy chaos in between. I'm your host, Jen Cameron. Let's get into it.
Eric, first of all, we are great friends, so I'm going to skip the bio, skip the formalities, and get straight to it. You are a Chinese American, openly gay, married man, wonderful husband, Chris, 2 children, incredible partner, raising this amazing family. You're also an epidemiologist leading the infectious disease efforts in America. How's your world these days?
It's very busy.
Yeah.
It's very busy. And not to mention, we also have 2 fur babies that are that's part of our lives. And so I consider myself very lucky to have this really great family, to have a supportive partner like Chris, great children, and 2 wonderful dogs.
Yes, you're basically a Fox News panic button.
There are a lot of things happening right now that cross hairs with the type of work that I'm in.
Yes, true. And we'll get into it, but we have to tell the story of how we met. So I'm going to have my version. You're going to have your version.
Sure.
Somewhere in there.
Yeah. Bring it on.
Okay. So you were referred to me because you were considering a move to the Seattle area. At that time, you were working for the CDC in Atlanta. Correct so far?
That's right.
Right.
That's right.
And you called me. It was winter. And you were going to fly out with Chris. This was before kids. This was when you were 2 single.
Yep.
Living the life. Well, you were married. You weren't really single.
Yeah.
So, but you were traveling all over the world.
Yeah. Childless.
Right? Childless. Yes, with your 2 dogs. We met. You flew in for a weekend. I picked you up.
Yeah.
I remember I had all the cute little goodies in the back, and
How crazy was
knew
that
what
whole
you
thing?
did. I don't know, but I had like hand wipes and stuff.
Oh,
I remember it was just like waters.
It was so fancy.
Yeah, it was very fancy in the back of my car, and it was love at first sight. I knew the minute we met, we are going to be friends. But we had a busy Fast and Furious weekend, and we looked at all kinds of homes.
We did.
And we were about to give up, and then you were flying out the next day. And I said, you know what? Wait, there's one more. Can I just show you this one before you take off to the airport?
That's right.
And it was the one.
It was the one.
Okay.
And I think I recall you maybe shared that house initially, and I wasn't sure how I felt about it until you saw it.
Too north.
Too north, and I wasn't sure about the outside, but now I just love it. And so you really created a firm and very concrete foundation for us to build our lives in Seattle. And you're right. So I agree with all those aspects, and a little bit from on my side. Right before I came to Seattle, I don't know if I've ever told you. Just a few days ago, I had flown back after spending a month in the Democratic Republic of the Congo.
What?
So we were working on Ebola. We were on the ground supporting the World Health Organization. It was really great to work with wonderful people there. But I certainly was tired, came back, but was very eager to see what our life could be like in Seattle. And at that point, we decided we're going to be in Seattle, but where we were going to live was an unknown. And same. It was kind of like friendship at first sight, right? Just like we just hit it off. We had good vibes, and you knew exactly what we were looking for. And yes, it took a little bit to find the right house, but we found it. And it's the house we still live in.
It literally took 48 hours. So it was not that bad. But the important parts of the story are you weren't going to move for about 6 months. So you had time to do the things to the home, even though it was new construction. You wanted to add a wine cellar and do some things.
Sure.
And you said,
December 2019.
Yes, December 2019. Don't give away the best parts. You're like skipping ahead too far. But there was a moment when I went over to the house to check on the construction of the wine cellar. And this was actually, I think I just jumped ahead too quick. If I go back, I had called you once. I had heard rumblings about a possible pandemic. And I was at Whole Foods. And I called you and I said, Eric, I've heard that there might be a pandemic or something, and Scott's going to visit his mom in Toronto, and I'm at Whole Foods, and should I buy this lavender hand sanitizer? And you said, Jen, you're probably going to want the real stuff. And I went, okay, thanks so much. And then I hung up and I looked at my phone and I Googled, what is a pandemic?
I remember that conversation. And I think we talked a little bit about alcohol content in the hand sanitizer a little bit. So it was kind of an interesting time because I think even at that point, it wasn't officially declared COVID-19 wasn't declared a pandemic. So what was happening in the world was largely still like people were trying to make heads or tails of it, right? And what that meant for the United States too. So yes, some people were predicting and projecting that this is likely to be a pandemic at the time that we had our conversation. And I think at that point, maybe I was part of the CDC team that then got deployed to Seattle to help with the investigation of the initial cases.
You didn't tell me that, but I called you from your house and I said, Eric, I'm standing in your kitchen. It is so dusty in here. I really think we need to get a housekeeper. And by the way, your yard needs to be cleaned up. And you go, Jen, I would be so grateful if whatever you think needs to be done, I know you have your people. If you could just organize it and send me a Venmo request and I will make sure I reimburse you right away. I'm actually getting on an airplane to Seattle right now. And I hung up that call and I don't know if I ever told you this. I was so hurt. I thought, you know what? I can't believe he's coming to Seattle and he's not like, do you want to grab a cocktail? Do you want to meet up? Blah, blah, blah. And the next day on the news, it's Kirkland nursing home breaks out, COVID, et cetera, et cetera. And in my heart, I went, oh my God, Eric's coming here because this is the beginning. And it was.
Yeah, needless to say, it was an interesting time for everyone. Again, there was very little known at that time. And it was hard to make heads or tails and trying to make sure that people had the right information that was really on everyone's mind. So I regret not telling you ahead of time, but I think we made amends and we continue to be friends to this day.
There was no amends. People often say, that what's the moniker or whatever, what would Jesus do? During the pandemic, I said, what would Eric do? Except for he's my friend and I'm going to call him and ask him all my questions. And I know I shouldn't because he's really busy, but whatever he does, I'm going to do. And you were so good in helping me stay calm and especially giving me really good factual options for working with Jordan during that time because she was obviously taking a lot of medications and it was a very complicated thing to have a child with disabilities and things. So thank you for that. But I would like to kind of switch this. We'll get back to the whole, saving the world one by one there. But I want to talk about the heart. And you are a new father again. Congratulations, Miss Madeline.
Thank you.
And Massimo. And how old are they now?
See, Max is almost 3, so that means he's very much embracing the three-nager phase. And Maddie is now 3 months, almost 4.
Yes.
Wow.
Time
has flown by.
And Chris have literally the most beautiful babies. It's almost a crime that you're stopping at 2. But
I think we're done. We have to survive this parenting thing.
That's right. Let's talk a little bit about that. You're raising your kids in this climate of what I will call uncertainty.
Yep.
Politically, environmentally, socially. What gives you hope for their future?
Yeah. Gosh. Uncertainty is a word that I continue to use every day in almost every conversation because that's just the reality of things, right? Hope. It's hard to sometimes talk about considering all of those aspects that you had raised. And, to be quite honest, I really enjoy, being among my friends, people like you, Jen, who manage to do it all and maintain that energy despite all the things that are happening my coworkers who continue to maintain passion in their work are committed to the community and safeguarding people's health. And that's what continues to energize me, right? To make sure that there's a future for my kids, my family, moving forward. And so hope is somewhere in there. But again, some of it is about like just maintaining energy to move forward. And all of that kind of feeds into it. So thank you for sharing that with me.
How will you teach them to have pride in who they are and resiliency as well as yourselves, and to embrace who they are and their culture and being raised by two gay men?
Yeah.
When the political climate right now or the temperature is very divided, and there's so much out there, and they're growing up in a really unique time.
Yeah.
It feels almost as if we're going backwards, not forwards.
Unique is right. I would probably use the same word. I would say, it's all about living openly and honestly, and being confident in yourself. I don't think that there's necessarily any type of parental playbook here. So, we're probably winging it just like everyone else and just trying to learn from our own mistakes and what we had experienced as children, the positives and the negatives, and how that continues to influence how we do things today. So, again, a lot of it is uncertain. So what direction we take is maybe going to be different in the future.
Well, I always say the most important things for Jonas and Jordan, my two children, is that they know that they are loved.
Yeah.
And clearly they
That's
are.
right.
So
That's right.
this is a more of a serious question coming off of that. I need you to be honest. Do your plants have names? Do they get more I love yous than your children?
Oh my gosh. Yeah. So most people probably just looking at me, they wouldn't necessarily think, oh, he's a plant guy, right? But let me just say, I've always been a plant guy since I was in elementary school. And that interest and hobby has only exploded since the pandemic, like many other people. And usually what I tell people is like, oh, they ask me the question, oh, you're into plants, right? And I tell them, I was like, I don't think you're prepared for the conversation that's about to occur. But to answer your question, they don't have names, except for their scientific names, which I'm obsessed with.
Give me three names.
Like, yes,
scientific names.
Oh, okay. All right. So for those people who are interested in plants, they're probably familiar with one aroid called a Philodendron spiritus sancti. One plant, orchid, that I'm particularly obsessed with right now is called Neophonetia falcata, which is a Japanese orchid. And then I've been really into collecting Acer palmatum, or most people would probably know them as Japanese maples, which grow actually really well here in Seattle.
This is fascinating. So it probably seems funny to talk about your plants, but so I have to create this visual for people to understand that we were having dinner. I was at your home, and obviously I've been in your home many times, but this one particular time, I feel like I went kind of past the powder room and glanced over at your office.
Oh yeah,
and pushed the door open.
Oh yeah,
Eric, it was like 100 plants in there.
At least,
and
that's just one room.
That is one room. So if you were to guess between your office and your back patio where you have all the potted plants and now your atriums that you're building, how many plants?
No.
This is Chris Chambers. You can thank me for this intervention that we're having on Homegirl Knows Best.
I wasn't aware we were going to enumerate the number of plants today, but there's probably well over 1,000 between my yard and the plants in my house.
It's bananas. So, okay.
Can I just clarify though? Some of these plants are really tiny. These aren't just giant trees.
That's right. They are. I mean, I'll sort of give you that. It's a whole thing. Anyways, if your dinner table could speak, what is the vibe in the Chow Chambers household right now?
As much as I'd like to share or spill the tea on something really spicy or interesting, it's about order, right? And what's good is that Chris and I are on the same page. We have to have a schedule. We have to have order with our kids to make sure that things go smoothly so that we can have our alone time, right? And I think other parents can probably agree. So that is probably the vibe that you hear. Then there's like little flourishes of Chris talking about his work day, my work day, which is always a little interesting.
So what you're really saying as a new parent is that the vibe at the Chow Chambers household is organized chaos.
Yes. Oh, yes, exactly. Perfect descriptor of kind of what we're encountering.
Oh
now.
my gosh. Can we talk about Emma?
Yes.
Okay.
Oh.
So you guys had, sorry, Emma and Riley.
That's right.
Brother and sister, twin dogs. Not that they're twins, but Emma was diagnosed with cancer.
That's right.
And nearing the end of her life, and you decided to take her on one last journey. Can we talk about that? Can you just share what kind of prompted you to do that? I thought it was just the most beautiful thing. And tell me about, where did you go? What did you do with Emma?
Sure. And thanks for bringing back this really happy memory. I just, every day, there's not a day that goes by that I don't think about Emma. So Emma, at that time, was our 9-year-old golden retriever, who we had since a puppy. And we were given a very bad diagnosis of this cancer that will take her life, despite all the medical interventions we pursued. And actually, the credit goes to Chris regarding this road trip that you're describing, where we took both dogs in the car, and again, before kids, and we drove from Seattle all the way down to Los Angeles. And with a few stops along the way. And we thought it was going to be really important because Emma loves being outdoors. So we went to Trinidad, California, which is where the Redwood National Forest was. And it was just unbelievable. For those people who haven't been, highly recommend it. Then we went down to my family's vacation home along the beach in Central Coast, California in Morro Bay. And then we went to see my family down in Los Angeles. And I am so glad that Chris encouraged me to take that trip because, I probably could have used a work excuse to say, I don't have time at the time. But he thought it was really important. I'm so glad that we did that.
Oh my gosh. I just think sometimes when you lose a pet, a family member, that's the way we look at our dogs. You're not prepared for that grief.
Never.
And people that don't have dogs don't understand that it's irreplaceable. Like you can't, the only thing I can tell you is that you usually, if you are a dog lover, you end up getting another one because you're like, this grief is so deep, I have to replace it. And now you have.
Yeah. Eva. That's right. Yeah. Our intention was not necessarily to replace, but, we knew that, there was so much joy, right, in having a dog. And even though we acknowledged that it's only for a very short time, that joy, the other 10 years that we would have with them was so rewarding. Yeah. And we hope to be able to give them a good life while they were with us.
Well, that story of Emma is like straight out of a novel. You just go, I can't believe that. So
she was such a good dog.
I know. So we've bonded over our dogs, your two cute kids. If you keep having them, I'll keep being your friend.
We're done, by the way.
We're done. We bond over being foodie and wine lovers. At first, I thought it was just ice cream. I thought that was our bond. And now I have come to realize that when it comes to dessert, you're an equal opportunist.
Oh, yeah.
And you will wait in line for hours, as you did recently for donuts. But what is your death row dessert and your go-to celebratory bottle?
Ooh, wow. Good one. Let me think about that. Dessert. Gosh, there could be so many. I will actually name two. One is one that is like a dessert that I had recently that really made me just take a moment and say wow, I experienced something really special. So this is like a tiramisu that I had while I was in Singapore. And it was served on this plate in this kind of circular, kind of somewhat contained plastic. They removed the plastic, and what you realize is that on top was this liquid cream that then just poured over the cake.
Get out.
And it was layered with different textures a piece of chocolate that was so decadent. And so when you're going through the different layers, you have the experience of the textures and the flavors and the temperature differences. I don't know how they did that. I can't wait to go back to have that. So that's certainly high on my list.
You have to go to Singapore to get it.
Yes,
though.
I do. Yes, I do.
Okay.
I'm sure other places have it, but that is where I experienced that one dessert.
Oh my God, the way you describe that, I'm over here and I'm like, do
It's
I need to
amazing.
go to Singapore?
Okay, so my mom's in Singapore right now. I told her she has to go get it again because it was we shared it between the two of us.
And it's not like you can send it as a gift, like the white pineapples.
If only. Oh, the white pineapples. Oh
Yes.
my gosh. Okay, so we got to talk about the white pineapples because that's
There's nothing like them.
No. What people may not know is that there's this white pineapple. The flesh is a lot lighter than what you typically associate with the pineapple, but it's low acid, very sweet, and you can eat the core. And it's grown by this, this place in Kauai. And so we have a shared appreciation for Hawaii, and now a shared appreciation for this pineapple. Which, again, it's it's a very special treat.
No, I ate like 4 of them in 2
Yeah,
days.
yeah.
It was insane. But when you're talking,
Yeah.
if somebody was listening to this podcast right now
Yeah.
and they didn't know you and
Yeah.
they heard you describing food, they're like, he is so serious about this. He's so into it. And it's true.
Oh,
Like-
because I love it.
I know.
Because I love
I
it so
know.
much. Yeah.
What are you serving with that tiramisu? What is your bottle?
Oh,
We're celebrating
Gosh.
right now. We're eating this tiramisu.
Okay. All right. I want to preface that there are so many vineyards out there that are and wineries that are just really spectacular, particularly here in the Pacific Northwest. But I will highlight that I do like sparkling, and a recent sparkling that I've discovered is from this vineyard in Willamette Valley called Adelsheim. And it's a sparkling Pinot Noir that was made in the same kind of process as champagne from France,
Ooh,
and it is spectacular.
what's it called?
I actually don't remember what the name is, but it's a sparkling wine from the Adelsheim. It's a white sparkling.
Okay, you're going to need to go home, take a picture of the label,
Yep.
and then I'll put it on my Instagram.
Oh, sure,
okay?
sure. Yeah. Oh, I love it. Oh.
Mine, okay, I love Domaine Carneros, La Reve,
Mhm.
champagne.
Yes.
That's like, to
You
me,
told me that.
everything. If it's going to be a red wine and I just really want to indulge, it's Contessa all day long.
Oh,
I
yeah.
mean, there's nothing like a Napa Red. I love Pacific Northwest, but
Yeah.
ours are a little more earthy. That's just a little.
Oh, can I share a little bit about
Yes.
my recent wine adventures? So Chris and I decided to take advantage of a little time that we had during parental leave to really enjoy and indulge in the Pacific Northwest, because I think we historically have had our biases towards European old wines,
Mhm.
right? Or like Napa Valley, which has really dominated the field. And those are all great and wonderful, but like there's something to be said about the Pacific Northwest, right? Not only in Willamette Valley, but here in Washington. And we went over to what's the
Walla Walla?
No.
Woodinville?
Yeah, Woodinville. Sorry. In a moment of
I said
recall.
far or
yeah.
close?
No, Woodinville. So Woodinville has a bunch of tasting rooms from Walla Walla, Columbia
Yeah.
Valley. And we were really able to explore what it meant to have a truly good wine, red wine, rosé, sparkling, white, all right here from Washington.
Okay, favorite winery.
Ooh.
And listen, you can't say, oh, there's so many. You have a favorite.
There are many. Long Shadow.
Oh, wow.
Yeah.
Okay.
Long Shadow. They have some really spectacular wines. Some of them are grapes from Italy, but now grown in Washington. And, that just really knocked our socks off.
It's really interesting because people just think of Washington as a tech hub and we lead in healthcare, and they don't
It's true.
understand that we also we lead in wine.
Yeah.
We're
yeah.
one of them.
Absolutely. Absolutely. And honestly, I started off very superficially saying, oh, I don't know about that. But I really had to try it. And gosh, folks nailed it.
Yeah.
Yeah.
I know. I'm also a DeLille fan.
Oh,
Forever.
I loved it all. Also.
I know. You're a newcomer. Just try to keep up. Okay. Let's go through 2 more.
Sure.
Salt and Straw or Molly Moons?
Oh, Salt and Straw.
Me too.
Yeah.
Me too.
Yeah. I mean, not every flavor is my favorite, but
Yeah.
there are some spectacular ones.
Okay. So if we were building the ultimate Eric approved dessert plate, okay, what's the non-negotiables? Texture, sauce, possibly a backup dessert in case the first one isn't enough.
Yeah.
Or are you just going to go straight back to that tiramisu?
I mean, the tiramisu is hard to top, to be quite honest. I mean, another one to give people some ideas to what I'm into. There used to be this restaurant in Ballard called Sawyer. You probably, I think
Yes,
you've been
and
there
it
too. I
closed.
know, I know.
How did that even happen?
I don't know.
Everybody was obsessed with
It was
Sawyer.
so good. It was so good.
Yeah.
It was such a great representation of Pacific Northwest cuisine,
Mhm.
right? And the chef and the staff were so talented. But I think it just highlights the realities of the restaurant business, how stressful it is,
Yeah.
right?
Mhm.
Even for a place as successful as Sawyer, it's not easy to maintain. So, I mean,
I
kudos
heard
to
that-
them to
I
make that
heard that it
decision.
was really hard after COVID. You know, all the restaurants shut down
Mhm.
and so many people went and found jobs
Yeah.
that just even getting consistent labor force for the restaurant
Yeah.
industry was
Can-
just
Can't even
problematic,
imagine.
you know, and then
Yeah.
people want the best of the best, but it's
Yeah.
expensive, right? So
Yeah.
the profit margins.
But
But
one area that they did excel was desserts. They had a quattro leches cake that I said was by far my second favorite dessert ever in my life.
at Sawyer.
Yeah, at Sawyer.
Okay, so you know what's going to happen. Everyone's going to start talking about Sawyer again, and
Yeah, I know.
like,
We're gonna try
bring
to
it
bring
back,
it back.
bring it
Yeah.
back, bring it back.
I wish.
Okay, so there's no way that we can't talk about your career.
Sure.
Epidemiologist.
Mhm.
I've learned, I've perfected the word finally. I don't have to use phonics anymore. When I met you, it was clear, you know, person is brilliant, smart. You went to Stanford, correct?
I did.
Yes. Okay. Was this always your path? Did you know I'm going to grow up and be an epidemiologist and work on infectious disease and do all these things? Or how did you end up there? How did you
Yeah.
land in choosing that field?
Yeah. Good question. No, the answer is no. I didn't always know that this is the line of work that I wanted to do. And to be quite honest, I'm not sure I would have been able to give you a good answer of what an epidemiologist does, even early in my medical training. And it wasn't until I really dove into it that I really understood the breadth and the scope of the work. When I was a kid, I knew I was interested in science, more on the biological sciences front. I love plants, as you know. I kind of had this dream of like, I'm going to do orchid conservation. I'm going to bring plants from all around the world. I'm going to help people like conserve these plants so that they don't pull from the wild. And I remember my grandmother saying one time, she's like, you can't be a florist. And I was like, that's not what I'm trying to do. Again, needless to say, plants have continued to be a part of my life, just not necessarily my career. I think it wasn't until I did an internship at the Institute of Medicine while I was an undergrad, and that really had that transformed kind of like what I had set in terms of like my career path. And I realized talking to a lot of experts and people that really role model what it was like to be a leader in this space, I knew that I wanted to be a physician at that point, and that going to medicine was my pathway to, bringing together all my varied interests. After medical school and residency, I decided to join the CDC doing their disease detective training program known as the Epidemic Intelligence Service. So this is a training program to help you build your skills as an epidemiologist, and that is to be able to study disease patterns, to be able to understand what is normal, what is not, to indicate periods where there's outbreaks. And again, it's important to recognize that epidemiology is not just infectious diseases, but also chronic diseases too, right? Understanding when there's a change. You may remember there was a huge scare and an outbreak of lung disease associated with e-cigarettes at a certain point, right? at that time, it wasn't known whether this was infectious or non-infectious. And so epidemiologists came to the States and tried to understand like what was the common factor that was affecting everyone to then arrive at the actual cause, the e-cigarettes.
Wow. Okay.
Yeah.
So I met, my brain just goes flat. It's so far from anything that I do in my life. And it just makes me so incredibly grateful for people like you that do this, to know that I have someone like you looking out for me. So thank you for that. You were at the CDC when we met, and then you came to Seattle and you transitioned to the University of Washington.
Yeah, so that's where I did my infectious disease subspecialty training. So just to get a better handle on like the diverse kind of clinical pieces of infectious disease, which would then support kind of the work that I would do eventually now in my current job doing, public health work.
Okay. When you were at the University of Washington specifically, did you work on long COVID symptoms and...
Yeah. So at the University of Washington, University of Washington has many experts, certainly in infectious diseases. And so I just really like kind of a kid in a candy store, so many people that I could work with. But specifically, I just shout out to Dr. Helen Chu, who was a respiratory virus epidemiologist and based at University of Washington, who had a really important role to play at the beginning of the pandemic, describing some of the transmission that was happening in the community. And I got to work with her. Some of the work that I did with her was around long COVID.
And now what is your current role?
So currently I work at the county level, involved with communicable disease epidemiology. So basically I work with doing all the stuff that I've been doing up until this point, but doing it more on the county scale. And I would say it's been just so great working with people who are so passionate, even to this day, despite all the challenges that we faced.
Yeah, no kidding.
It's wonderful.
That's an understatement. Okay, so you were like literally in the eye of the COVID storm. And what was the moment that you will never forget from that experience?
Gosh, there's so many. I would say the one that stands out in my mind is receiving the call to come to Seattle. And to be quite honest, I didn't understand the scope or the breadth of what was about to happen. I don't think really anyone else did. Maybe some of the folks here in Seattle were starting to understand what was about to change. But what was then uncovered, I think, was far bigger than what anyone else had anticipated. So it was kind of, I suppose, whatever you could define as a normal Friday night. And then you get a call that says that you need to deploy and we need your help. And me, along with a small group of people, came out. And that was that.
And you were still fairly young in your career, right?
Yeah, earlier. Yeah.
Yeah. So I think in the general public's mind, right? This is what you've studied for. This is what you've trained for, almost like the military. And then you get deployed and you're sent out. And now it's like real time, real action. I cannot even comprehend what that was like, especially as, the whole country decided to fight about it, right? And politicize it. But what's a myth about COVID you'd like to debunk?
I think this concept that COVID wasn't a big deal for you, so you don't have to care about it.
Oh.
Yeah. And I think that is something that we're still trying to help people understand that, sure, maybe that one infection wasn't impactful to you, but the choices that you make around COVID and other respiratory viruses certainly have an impact on the other people in the community, even people that you may care about and love, right? It's not always evident when people are high risk because I think people have a certain image in their mind of like who would be high risk, but that's not always clear. People who are immunocompromised still carry a significant risk and sometimes live in a really, they're very careful with the actions that they take. And so other people's actions really can impact their own safety. And so those are the things that I try to convey to people to help them realize that it's more than just the risk to you, but it's
Mhm.
also a risk to the people that you care about in your community.
Yeah, caring,
Yeah.
community,
Yeah.
humanity.
That's right.
It was really interesting. Jordan relies on hydroxychloroquine. That's
Mhm.
one of her. Did I say that correct?
Yeah, that's right.
Okay.
Yeah, yeah.
All right.
Yeah.
We're doing good so far today. As one of her primary medicines
Yeah,
for her
yeah.
rheumatoid arthritis. And there was a lot of people at that time that were taking it because they thought it was going to cure COVID. And our doctor had shared with us that there was a lot of people writing prescriptions for family members that didn't really need it. And I
Mm,
went to get Jordan's medication and I couldn't. And
yeah.
they said, we only have a 30-day supply left. And we have a client of the pharmacy who depends on it for life. And we really need to give it to him. And I think I must have shared something on Facebook and it was amazing. There was somebody I worked with
Mm,
who called me and said, I have a 30-day supply.
mhm,
I'll be okay. Let me give
mm,
it to you for Jordan.
mm.
This later I found out we don't even vote the same. We weren't, we didn't share all the same
Mm.
politics, but here she was giving me her medicine for Jordan. And I'll never forget that. To me, that's the best of humanity in those
Yeah.
situations is how do we help each other?
That's right.
Right?
That's right. The small acts of kindness. You asked me earlier about like what gives me hope. I still see those moments of small acts of kindness, that bridges politics and, et cetera. And, people who continue to bring communities together to be
Mhm.
able to articulate impacts and, really, support one another in this
Yeah.
time of uncertainty. And, that also really brings me hope.
Yeah, let's build bridges,
That's right.
right?
That's right. Gosh,
Um,
what a heartwarming story. Thanks for
yeah,
sharing.
I know. I should call her and remind her and thank her for that. Um, how did politics interfere with science
Mm.
during COVID?
I get this question often. I think what I try to help people understand that when we talk about public health, there's inherent political component to public health, right? Uh, yes, we talk about the science, and that's obviously a critical component. But we also have to think about, okay, so this is an ideal situation, but we also have to think about buy-in, feasibility, the resources available, the impacts of implementing the science, right? And that is placed on values that people have. And values may differ depending on the place that you live and also the size of the city and the types of people that are there. So there's always some intermingling there, and that's a normal thing that we're used to within public health. So we try to navigate that. And COVID is an exception for many different reasons, right? During the beginning of the pandemic, it was such a huge thing. This is the first large pandemic that we've had in many years, although we had a pandemic back in 2009 that maybe some people have forgotten about. But there was also a lot of uncertainty. COVID-19 didn't behave in ways that we could predict for those people who study respiratory viruses. So you kind of had to infer based on your experiences with other diseases, but then also adapt when you learned, oh, actually, we need to change. And so helping people understand like our thought process and how we learn and shift, I think was one of the biggest challenges.
Wow. Well, thank God for science. What do you think the biggest systematic failure is that you still see in public health today?
Public health is never one static entity, and the landscape is constantly changing. We should change because the science is changing, our values change, our understanding of disease changes. So we have to adapt to the moment, right? And I think one of the biggest kind of learning points, certainly for me, and I think for a lot of us, is how do we communicate, right? Public health often says, like, we're doing our job if no one knows about us in the background. But I think times have changed. I think we really need to ensure that people have the tools to understand how do we come to a decision, right? What is the science? Not everyone's going to know the nitty gritty of viruses, et cetera, but people should know kind of like the value that we place in making certain decisions. So when we say to do a certain intervention, even though there are impacts, what we're looking at are the potential impacts that could have happened if we had not done a certain type of intervention.
Wow.
So some people don't think about that.
No, how would you?
Yeah,
I think
right.
if you don't understand the science behind it, you don't understand the process behind it, it's so much easier to just say, no, to the idea of it. And I think what you're talking about is more information and more understanding and educating the public in a way that hasn't maybe traditionally been done.
Yeah,
Been done.
that's right. Yeah.
Be done.
Yeah.
Been done.
Sure.
Okay. Why do you think public health leaders burn out, and how do you protect yourself from burning out? Because I know that has got to be a real thing.
Yeah. I mean, burnout is definitely a real thing among public health folks, people in the clinical medical world, research, certainly. It's hard. Actually, I didn't mention this earlier, but both my parents are pharmacists. And they actually told me to not go into medicine, kind of to preempt me.
What did they want you to do?
They say anything else that you enjoy, just not medicine. And then here I went down this path of like, okay, I'm not going to do medicine. Oh, here I am. I'm going to do medicine. And so, I'm sure they're so proud of that fact. But it's a kind of interesting tidbit earlier in my life. People get burnt out just by virtue of the demands of the job. In ways that I think a lot of people don't understand. And for a lot of people, they experience debt also, right? Not only are they facing the responsibilities of the work, but also trying to pay back debt. The other thing that I think a lot of people don't realize is that you're carrying other, like the emotions and the realities, the impacts of the patients you care for, right? You're invested in making sure that someone's outcomes are as favorable as possible. And sometimes it doesn't work out that way. And you see people in really vulnerable situations, and that comes home with you. You see that, in the memories, obviously, of interacting with the patients, but also shapes kind of like what you think about life, how you value things, what you want to do and prioritize for your family. So it's hard. And I think in public health, it's very similar, too. And not to mention the other kind of competing demands and the kind of the back and forth, the ebbs and flows of kind of public health funding. That's challenging. And going from heroes to not heroes, that's hard for people who are really committed and driven by the work.
Oh my gosh, I can only imagine. And I'm so grateful again that we have people like you out there doing this. And it's really interesting to hear, in a profession where my whole life plays out on social media. Right? For better or for worse, there's probably nothing you don't know because it's all out there, and you're in such a different profession. It's not being put out there in that way, right? Who are some of your favorite people to follow on Instagram within your field?
Oh, within my field, there is a great Instagram page called Your Local Epidemiologist. So you can work on the pronunciation while also better understanding like what public health does. This person is a PhD epidemiologist, so a research scientist, but where her strengths lie is being able to communicate to people why public health matters and what are the public health impacts. And her posts appeal to people of all backgrounds, including people who are professionally in that space. Because it's not only a nice summary, but it also gives us a guide as to how we can better communicate to a wider audience. And so I encourage people who are, regardless of what your background is, if you're interested in what is the here and now, what's going on, what are the hot topics in public health, that's a great site to follow.
Okay, wow. Okay, we're switching subjects, and Scott will tell you all the time, Jen, I can't read your mind. But this is really important, and I want to talk about this with the rising threats to gay marriage. Do you ever feel like your family's in jeopardy?
It's something I do actually frequently think about. I'm not probably at the point where I would use the word jeopardy, but I do have to think about the safety of my family from different aspects, right? I never take my privilege or the great things I have in life right now for granted. I really have to think about the real possibility that that could all go away at a moment's notice. So I have to be prepared. Yeah.
That's your way of coping, is just to be prepared for the what ifs, right?
Yeah. And the problem is you can't be prepared for every what if
No, you
that's out
can't.
there.
As a woman, I've come to the reality that's brutal. Your rights can be taken very quickly. You can never take it for granted.
Yeah.
Because if you take your eye off of it or you don't advocate for it,
Yep.
it'll happen.
Yeah. If you don't
right?
speak out.
Yeah.
Yeah.
As a Chinese American gay man, where's a moment where your visibility has impacted or changed someone's life?
Great question. Gotta take a moment here. I would say probably the biggest change in an individual was actually for my own dad. Yeah, right here at home, who started off maybe, not knowing very many out gay people, had a certain idea as to kind of like what that was all about, and kind of echoed some of the lines echoed by other kind of religious figures. So it was always a delicate dance for me when I had come out, but not yet to him. Fortunately, my mom was very supportive and helped me navigate that situation. And fast forward, almost like 10 years after I actually came out, when my mom helped me come out to him by doing it for me, he did a complete 180 transformation. Suddenly, he was an advocate within his church group. He created a space that was safe and open for other people who had been disowned and cast aside by their families. Frankly, I was really impressed and shocked, honestly. And he was my champion until he passed away last year.
Yeah.
Yeah, that was pretty remarkable.
And he was you share a little bit of his DNA, because I heard that he was a connoisseur of almond croissants.
Oh, yes, that's right. That's right. See, the foodie aspect doesn't fall far from the tree. So, yes. So he was a connoisseur of almond croissants. And again, I love almond croissants. It's a part of my life, but I didn't understand it to the degree that he did. But he talked about paste versus pudding and all this other aspects. Again, I'm probably not even using the right terms. But he would eat an almond croissant everywhere he went. So certainly from an experience level, he was the expert.
I love that. And you can carry that tradition on. So today we learned that saving lives, raising babies, fighting disease, keeping your thousands of plants alive is apparently all in a day's work. But Eric, you're not just a public health icon. You're Seattle's Beyonce with a medical degree. This episode was never intended to be just about medicine. It was about the heart of who you are. And it's about love and legacy and this quiet power that you have to show up for others. I'm just a lucky recipient of that. So thank you for doing the hard thing, even when it's hard. Thank you for reminding us what leadership and real friendship looks like.
Oh, thank you. And thank you for allowing me to be a part of this new venture in your life.
Cheers, friend.
It'd be awesome.
Thanks for coming. If you've made it this far, thanks for listening, and thanks to my guest. Make sure that you like, follow, and subscribe so you don't miss the next one. See ya.